Good evening, I'm Ian Hanomansing. Tonight, a plea from the Prime Minister as the country's top doctors warn things could get much worse.
We know what to do, we know how hard it is, but we know it works.
Justin Trudeau returns to his front porch to ask Canadians to take action.
If you don't need to, don't leave your home.
His emotional new request to try to prevent this.
Our ICU resources will be completely overwhelmed by the end of December if nothing changes.
Our doctors are standing by with their take on today's news. Plus, Canada's biggest city in lockdown.
We are now teetering on the edge.
Ontario introduces the strictest measures since the first wave. And meet the people behind the numbers.
The breathing and all that's tough, but the isolation is really tough.
Stories from the second wave. This is The National. From Ottawa's COVID-19 projections to a dramatic new provincial move, tonight the moment seems clear. Things could spiral. And the message for Canadians is urgent. Step it up.
If you were planning to see friends this weekend, maybe don't. If there was a birthday party or a gathering for dinner you were thinking about doing, don't do it.
Just like the virus, concern from policymakers is rampant. Tonight, their worry is our focus. We'll get to new restrictions in Ontario, the latest pressures on Canadian hospitals, and stories of people most touched by the disease. And there's a lot to cover, so we've brought in some expert help. Dr. Susie Hoda and Dr. Isaac Bogosh are standing by, and they'll join me throughout the program. But let's start with a message from the Prime Minister aimed at provinces, cities, and individual Canadians. Here's David Cochrane.
So, I don't want to be here this morning. You don't want me to be here this morning. But here we are again.
Where we are is back to the beginning. The Prime Minister standing outside his house, urging Canadians to stay in theirs.
We're in a moment right now, or even with all the sacrifices I know Canadians have been making over these past 10 months, we are now going to have to really tighten up once again.
A Prime Minister's plea, fueled by new COVID projections that paint a dark picture. As CBC News first reported, the projections show cases rising to 20,000 a day if Canadians don't limit their contacts further, surging to 60,000 if they loosen up.
We are not on a good trajectory. So I think across the board or across Canada, we have to say that the time is now with urgency that we limit contacts.
Even the good scenarios could be more than the health system can bear, not just in terms of beds or ventilators, but healthcare workers who have been going non-stop.
And they're tired. They have been heroes. They have been going above and beyond anything they might have thought they were signing up for. We need to help them. We need to give them a break.
Canadians can do that by staying home, provinces and cities by tightening restrictions, with Ottawa offering financial support like a new rental subsidy that became law last night. Applications for needy businesses open on Monday. There's a top-up for those under lockdown.
Doing the things that protect our health are actually the best things to do to protect our economy.
These grim reminders come after positive news that vaccines could soon be ready, but even in the best case scenarios, those vaccines are still months away, which leaves the virus plenty of time to spread and deliver a second wave far worse than the first. David Cochrane, CBC News, Ottawa.
While the Prime Minister asked people to stay home, Ontario is telling them as cases in the province emerge faster than anywhere else in the country. Today alone, more than 1,400 new cases. Makta Gebrselassie shows us a province going back to square one.
Effective Monday, November 23rd at 12:01 a.m., Toronto and Peel will be moved into lockdown.
Today, Ontario's Premier delivered the hard news.
It's clear more needs to be done to limit community transmission of COVID-19 so that we can keep our schools open, safeguard our health system capacity, and protect our most vulnerable.
That means no gathering with anyone outside your household for at least 28 days. Gyms, casinos, and salons are closed. Retail is back to delivery and pickup. Rule breakers will face a fine of $750. Toronto's mayor backs it all.
The people who are getting sick are employees, they are business owners, and they are the customers of those businesses. We simply cannot have a healthy economy without healthy people.
Peel Region is sounding the alarm as some of its hospitals are already full.
So they're being treated in the hallways of non-traditional spaces. A lot of these people are sick, severely sick, and they have COVID.
When the new restrictions go into effect, there will be 2 regions on lockdown and 5 in the red.
The lockdowns and the restrictions, they buy us time, but they're not a solution. The solution is having strong test, trace, isolate support systems. And it's having supports for people.
You mind just grabbing a squeak of hand sanitizer here?
This barbershop owner says after working hard to keep staff and clients safe, this cuts too deep.
Why not find the people that are violating it, shut them down for 28 days, and let the rest of the people who are doing things properly survive? Because it's going to be a bigger shutdown than just 28 days for a lot of these businesses. And it's scary.
The province said it will help struggling businesses with more funding. Health officials say support for workers like guaranteed sick days is needed too. Magda Gebrselassie, CBC News, Toronto.
So let's bring in the experts, infectious disease specialist Dr. Susie Hoda and Dr. Isaac Bogosh joining us from Toronto. And doctors, we have new restrictions in your city and a plea from the Prime Minister. And Dr. Bogosh, let's start with you. What needs to happen in the next week or two in the Toronto area for this to work?
Well, a few things. First, we need time. It's certainly going to take more than a week before we start to see cases perhaps respond to these measures. The next thing we need is adherence, and which is going to be very challenging because one of the measures is for people to really stay at home as much as possible and not mingle with others. And we've definitely had problems with spikes in cases because of private gatherings. And the third is support, especially support for people, communities and businesses that are disproportionately impacted by the virus and by policies to combat the virus.
And so, Dr. Hoda, you as a doctor see this all the time, practical solutions beyond these general principles. What would you add to what Dr. Bogosh says in terms of what needs to be done?
Well, I think part of it is really just supporting people in terms of dealing with all of these measures going on for so long, the fatigue that's setting in. And some of that can just be how we message things. So, really trying to keep a clear, calm, concise, and consistent messaging around what needs to happen. And trying to be positive about some of it too. Not just having always bad news stories, but trying to show some of the positive to keep people going.
Clear, calm, concise, and some good news and all of that. I like that message, and stand by, both of you. We'll come back to you a little bit later on in the newscast. Well, today, Canada's top health officials urged political leaders across the country to be decisive about implementing restrictions.
As things escalate, and you're going to put in measures, do it fast. Do it early and do it fast.
And unfortunately, with the current, let's say, measures in place and also the activities of individual citizens, that hasn't been enough.
And while Ontario is clamping down, Alberta is not, at least not for now. The province announcing no significant new restrictions today. Its per capita infection rate is the second highest in the country. Alberta reporting 1,155 new cases today, setting a new record for the second day in a row. Rafi Boudjikanian looks at a worsening situation and the growing debate about how to handle it.
Our numbers are skyrocketing.
A new record in Alberta today, the second record-breaking day in a row, and the third time this week the province broke the 1,000-case mark.
I don't think anyone wants restaurants to close down, but it's not what we want, it's what we need. We might need that in order to make sure Grandpa and Grandma can make it to Christmas.
Today, no new restrictions, but the chief medical officer urged Albertans to abide by the protocols.
I am concerned, and the measures that we have put in place over the past several months may have somewhat slowed the growth, but they have not bent the curve as much as we need to.
A week ago, the province limited indoor group fitness programs and team sports and reduced operating hours for bars and restaurants. But this business owner is wondering if closing outright now isn't the better option.
We'd be in support of a
circuit breaker or a full lockdown if it is truly a full lockdown. It cannot be just the hospitality industry.
For weeks, the province has resisted a so-called circuit breaker shutdown, even as hundreds of physicians have asked for it to slow the spread.
What you describe as a lockdown, first of all, constitutes a massive invasion of the exercise of people's fundamental rights, their ability to put food on the table, to sustain themselves financially.
Alberta is now the only province without a mandatory indoor mask rule. We asked if the government is considering other measures.
So this week, what I've been doing is working with my team to prepare the suite of things under consideration. And the discussion about which measures would be deemed appropriate has not yet happened.
The province is asking for patience. One more week to see if those existing measures make a difference. Rafi Boudjikanian, CBC News, Edmonton.
And let's take a look at the pandemic picture across the country tonight, starting in New Brunswick. The province announcing 9 new infections today, and health officials say that starting at midnight tonight, the St. John region will join Moncton in the orange phase with tougher restrictions.
438 new cases of the virus have been identified. All these announcements are much more than numbers. These are people.
A man in his 20s, the latest deaths in Manitoba, the youngest person to die of COVID in the province. Today was the first day of tightened restrictions on gatherings and restrictions on sales of non-essential items. Shoppers at big box stores saw Christmas decorations, for example, kept behind plastic wrap. Nunavut adding 10 new cases today. The territory had a total of 84 infections since its first case was confirmed 2 weeks ago. A territory-wide lockdown started Wednesday. And here in British Columbia, what could be a sign of hope, the number of cases has been down significantly in the last 2 days. 516 new cases reported today. That's the lowest daily number since November 5th, and it comes nearly 2 weeks after some new restrictions. Each new infection puts an individual at risk, but hundreds of cases hitting hospitals at the same time, well, that's a risk to the system. And that's exactly where we are now. Over the past month, the number of COVID-19 patients in hospitals has doubled nationally to more than 2,000, about 1 in 5 in intensive care fighting for their lives, and increasingly losing that fight. Over the same period, the rate of deaths from the virus has more than tripled to an average of 70 a day. Vicadopia shows us how close Canada's hospitals are to the brink and what that means for Canadian lives.
With that new daily record of COVID-19 cases in Alberta, Edmonton's largest and busiest hospital is only getting busier.
The rate is picking up and the resources are not increasing at the same rate.
This ICU doctor isn't just worried about whether there are enough beds, but if there's enough hospital staff to treat all those patients.
We are projected to have over 100 patients by the end of November. And with exponential growth, our ICU resources will be completely overwhelmed by the end of December if nothing changes.
Right now, there are more than 2,000 people with COVID-19 laying in hospital beds in Canada. More than half are in Quebec and Ontario. But per 100,000 people, the situation is just as bad in the West, much of which went unscathed during the first wave. Overall, the total number of COVID hospitalizations is still only half of what it was at the peak of the first wave, but the situation is changing quickly. Meanwhile, many Canadian hospitals are racing to catch up on non-urgent surgeries, but delays are piling up. Charlie needs surgery to separate his small fingers, which were fused together at birth. It's been delayed twice.
So the longer that these fingers stay attached, the longer the chance there is for them to not grow at all. That has a huge impact on how his hand would function.
In Ontario, another freeze on surgeries could be coming.
We are now teetering on the edge of having to delay scheduled surgeries.
The province has crossed a key threshold of patients in intensive care, which would make saving lives that much more difficult.
We would be struggling dramatically, and particularly struggling if ICU care was not unlike what was predicted in Europe in Wave 2, where a significant number of people required intensive care.
Which would make saving lives that much more difficult. Vic Adopia, CBC News, Toronto.
Let's bring back Dr. Susie Hoda and Dr. Isaac Bogosh. One of the voices in that story is actually the president of the hospital system you work for. Dr. Hoda, tell us what's happening inside the hospital right now. What are you guys worried about? What are you watching?
Well, we're doing a lot of planning right now because, we run a pretty lean operation in hospitals in Canada. So it won't take a lot to tip some areas over the edge. So really what we're most worried about right now is staffing, because we are at the point where we're facing some shortages in staffing. And that's because people are getting ill themselves or off on quarantine because of or they have to stay home to support children who are home from school or other people in their families. But also we're looking at hospital beds, and some hospitals, as we've heard, are definitely feeling the pressures and having to transfer other patients out. So we're really looking at what that impact is in terms of who's coming in, but what's happening on the end of discharging patients from the hospital when long-term care homes are also full and facing outbreaks, and it sort of paralyzes the system. So many things in terms of the capacity of the system and our ability to provide care because of staffing are what we're looking at right now.
And Dr. Bogosh, about 30 seconds, but in terms of what you're seeing at this point with COVID, any surprises, anything different from the spring?
Unfortunately, there aren't any surprises. I'm just very concerned that we perhaps didn't learn the lessons that we should have learned in the spring, and we may be repeating some or many of the same mistakes that we did. Now, we know that there have been many changes. For example, I'm just going to focus on long-term care for a second. There were changes in place to help protect the long-term care facilities, and there were some significant positive changes. But we're now starting to see cases in long-term care, and this is a source of hospitalization and sadly death. And it just doesn't appear that we've done enough to protect the most vulnerable of our vulnerable.
And really, 3 months ago, we thought this was not going to happen again. So it's unfortunate to see that, in fact, it is in terms of long-term care outbreaks. Okay, we're going to come back to you guys one more time in the program, but thanks for sticking with us. As the epidemic worsens in this country, Chief Public Health Officer Theresa Tam said today Canada isn't testing enough.
So it will be different and varied, I think, across the country as to why we're not seeing wider testing. But, we will be trying to encourage more of that.
Nationwide daily testing rates have improved a lot since the beginning of the pandemic, but they peaked around mid-October. One sign we're falling behind, the rate of tests coming back positive is too high. The World Health Organization calls for test positivity of 5% or lower. Anything above that suggests testing is missing too many cases and losing track of the epidemic. Canada broke that limit at the beginning of the month, and in some regions, it's above 10%. Today, Dr. Tam suggested the problem is not so much capacity as access. It's simply harder for some to get to public testing sites. And many jurisdictions won't test people not showing symptoms. In Quebec, that's given rise to a new demand for private COVID testing. Alison Northcott looks at the advantages and the implications.
This is a fresh sampling kit that we use.
Nurse Melanie Jade Bouleris offers mobile testing for COVID-19.
We have the swab.
$180 per person with results in 48 hours.
There are demands for private testing. We have had an increase due to various reasons.
She says many of her clients want required tests for international travel. For others, it's elective surgeries. But she's also starting to book appointments for people wanting to see their families during the holidays.
I do expect that uptick in demand because the government guidelines to get COVID swabbed is not social gatherings.
But she cautions it's not foolproof and can't replace public health measures. In Quebec, public testing is reserved for people who meet certain criteria, including those with symptoms. It's similar in Ontario, but a ministry website says it does test travelers when required. Quebec says it's a personal choice to use private testing, but private or public, it warns a negative result could give a dangerous false sense of security.
I know that the test results aren't 100% guaranteed.
Megan Timmons and her wife, who's a healthcare worker, want to visit her family next month, and she plans to get a private test before they go.
I personally think that it's a gift that I would be giving to myself and to my family to be able to have that reassurance.
You can't fault people for wanting to think about how they can best protect themselves.
But Dr. Andrew Buzari says there needs to be more investment in public testing and tracing to ensure they're reaching everyone.
We don't make those investments and we allow the for-profit aspect to take real hold, we're going to see more and more inequities.
We're here to offer an extra service, not compete with the government.
Health Canada says private testing may be appropriate in some cases as long as it doesn't impact public testing capacity. Alison Northcott, CBC News, Montreal.
Canada is a very different place than it was 10 months ago. So on a day that feels like a turning point, let's take stock of the country's COVID situation. Since January, more than 320,000 people in this country have contracted COVID-19, many of them in the second wave. More than 11,000 Canadians have died from the virus, the majority coming during the first wave, but that number is once again on the rise. Statistics can be sterile, though. It's easy to miss the people behind the numbers. So we asked Christine Birak to tell us some of the stories from the second wave.
While most of us are seeing case numbers and graphs, some Canadians are living them.
This is very hard for me to do. But you know, you never think the virus will come to your house.
Edna Nabis tested positive in October following a wedding. She made that video here in tiny, remote Little Grand Rapids. While the first wave of this virus spared Manitoba's First Nations, a recent spike in cases has been devastating.
I know a lot of people thought that we were immune to this, that it wasn't going to come here, you know, until the second wave came.
The breathing and all that's tough, but the isolation is really tough.
Dr. Richard Doran spoke to us from his bed inside an intensive care unit. His wife, Jennifer, is also a nurse.
He has pneumonia. He also has the ground glass appearance in his lungs that COVID typically induces.
They don't know who or where he came in contact with the virus. But in Canada, healthcare workers represent almost 1 in every 5 cases of COVID-19. Dr. Doran is recovering, but says things could have gone differently.
I've treated COVID patients, so I'm getting the perspective from both sides. And I mean, you see people who get no symptoms, and yet I've seen people die.
My dad passed away.
No group has suffered more neglect and death during this pandemic than seniors living in long-term care.
If an airplane crashes with 40 patients on or 40 people on, it's a disaster. If a boat sinks, it's a disaster. Well, what do you got 40 people dying in a nursing home?
Larry Bailey lost his father just weeks ago. Glenn Alvin Bailey was in his 80s and full of life.
Hi kids, how you doing?
Always with a smile. Bailey says his dad touched so many lives through his years of community service.
Thank you.
The flowers haven't stopped coming. Bailey says people living in long-term care need better protections.
I feel so guilty that I got talked into keeping him there.
Unlike others, there was a goodbye.
I wouldn't leave unless he told me he loved me.
He did. Yet another moment he'll never forget. Christine Birak, CBC News, Toronto.
Well, a sobering reminder of the toll of COVID, and doctors, a last word from both of you. Dr. Hoda, you said maybe we should have some good news sometime, some cause for optimism. So here's a challenge for you. Where can that come from?
Well, I think thinking towards a vaccine is definitely something that's a nice beacon of hope for all of us. But also, we're entering into the holiday season, and it's a time for giving and generosity and hope. So, you know, I like to think of this as an opportunity for people to think about how we can support each other in our communities during this really difficult time so we can get through it a little bit more easily.
And Dr. Bogosh, we have about a minute. What should Canadians be thinking about tonight, this weekend, in light of these rising COVID numbers?
I think there are certainly things that are under our control. There's lots of things that are not, but there are things that are under our control. We can do our best to keep ourselves safe, our family safe, our community safe. And really, truly, vaccines are on the horizon. And with the snippets of data that we have available to us, they look like they're really, really good. I know we're not supposed to say it. We're not supposed to say they're a silver bullet. They might be a silver bullet. Like, they really might be an extremely helpful tool that helps us get out of this pandemic. And I think the very beginning of 2021 might not look so good, but as we move through 2021, I think things are going to just get better and better and better and better.
Really nice note to end this portion of the program on, and I really appreciate you guys taking the time late on a Friday night. Dr. Hoda and Dr. Bogosh, thank you very much.
My pleasure.
A jury has found Matthew Raymond not criminally responsible for killing 4 people in Fredericton 2 years ago.
I feel a bit as though the criminal justice system has failed us.
Up next, reaction from the victims' families. Plus, shop now, pay later. Yep, there's an app for that.
That's a little unsettling when you think about it.
What you should know before you sign up. And later, a very Canadian music collaboration. 2 pop stars, 1 new song, and lots of fan reactions.
I just think in light of the pandemic, we could use some good news.
We'll be right back. A manhunt is underway in Wisconsin tonight after a gunman opened fire inside a shopping mall near Milwaukee. At least 8 people were taken to hospital. The local mayor says none of the injuries are life-threatening. The suspect fled the scene before officers arrived. He's described as a white male in his 20s or 30s. There was an emotional scene in a makeshift New Brunswick courtroom today after Matthew Raymond was found not criminally responsible for shooting and killing 4 people in 2018. The CBC's Kayla Hounsell was in Fredericton for the verdict.
A blue line sewn into a mask meant to protect against COVID-19, but in memory of her partner who died trying to protect the public. Jackie McLean was hoping for a different verdict.
The mental health system failed the Raymond family in the first place. And now I feel a bit as though the criminal justice system has failed us.
Charged with first-degree murder, Matthew Raymond admitted he killed 4 people on that August morning in 2018, but said he thought they were demons, not people. Raymond opened fire on civilians Donnie Robichaud and Bobby Lee Wright from his apartment window. He killed Fredericton police constables Sarah Burns and Rob Costello when they responded to help.
No talking at all. I want to remain silent.
In the following days, Raymond maintained he didn't want to talk about what happened. In court, he testified he believed demons were coming to kill him because the end times had come. His lawyer says he's shown remorse.
His grief that he's expressed with us has been like palpable in a physical sense, like almost like completely overcome with grief.
Tens of thousands of videos and photos found on Raymond's devices showed bizarre calculations, demonic numbers, and a fixation with conspiracy theories. The Crown argued his delusions weren't so intense that he didn't know what he was doing. They pointed to the fact he altered his rifle so it could hold double the ammunition. This law professor says the not criminally responsible verdict exists for a reason.
It's a fundamental part of our justice system that we only punish people if they know what they're doing. If they don't really know what they're doing, it's cruel to punish them.
And I want to make sure that this individual doesn't have the opportunity to hurt anyone ever again.
Raymond will be detained at a psychiatric hospital. A board will review his case each year, but he will not be released until there is no concern about public safety. Kayla Hounsell, CBC News, Fredericton.
And Canada's Supreme Court ruled in another case having to do with a not criminally responsible verdict today. An Ontario man found not criminally responsible for sexual assault will no longer be required to report to police. Though granted an absolute discharge in 2003, the man, whose name is not public, was still registered as a sex offender and required to routinely report to police. Canada's top court says those conditions violated his constitutional rights. Investigators say 2 officers were responding to a property dispute yesterday when a 28-year veteran of the Ontario Provincial Police was shot and killed near Gore Bay on Manitoulin Island. A suspect was located inside a trailer when they arrived. The SIU says there was an exchange of gunfire. Constable Mark Hoving was fatally shot. The 60-year-old suspect was also shot and died from his injuries. The second officer wasn't hurt. When we come back, a tale of 2 provinces, how Ontario and BC are handling the pandemic. Our panel of doctors weighs in on the lessons and the warnings for all Canadians.
We are in our second surge, and it is proving to be a challenge.
Recent data, trends in key public health indicators continue to worsen for many regions in the province.
BC and Ontario, two provinces trying to control the second wave of this pandemic, but BC is taking a more targeted approach. The province is asking residents to restrict close interaction to members of their own household. Religious gatherings are also suspended, but indoor dining and restaurants still allowed. Gyms, salons, stores can stay open. Ontario, as we've told you, has announced a lockdown in Toronto and nearby Peel as of Monday. Gyms and personal care services like barbers, salons will be closed. Restaurants and non-essential retail stores can only open for pickup or delivery. So why the different strategies, and will one be more effective? We're joined now by infectious disease specialist Dr. Srinivas Murthy, who's in Vancouver, and Dr. Zane Chagla in Mississauga. And Dr. Murthy, I want to start with you. As you know, case numbers here in BC rose sharply in the last week. What do we know about where the spread is happening?
A week or two ago, it was mostly limited to Vancouver and the Lower Mainland more broadly. But over the past week, I think people have seen that it's spread around the province to the north and to the island, which obviously is concerning. In terms of, I guess, which activities are driving the spread, what we do know is, I guess, the gatherings of people are what's driving it: workplaces, healthcare, social gatherings. And that's what's targeting our control measures right now.
And Dr. Chagla, what about in Southern Ontario? Is there a sense of where COVID-19 is spreading the most?
Yeah, it's trickier at this point. We're seeing rises across most regions, but certainly centered around Toronto and Peel. The issue is Toronto over the last month has stopped contact tracing, so we really don't have great ideas of what environments these are coming from. And Peel region similarly did the same this week. And so, there is a certain recognition towards some certain public-facing gatherings, not necessarily bars and restaurants, as they've been closed for some time. But workplaces, both essential and non-essential, and again, home gatherings too. It's just very difficult without appropriate contact tracing to know exactly what the issue is.
Yeah, which I think leads to the next issue I wanted to raise, Dr. Chagla, that, BC is not locking down, nowhere close, even though the per capita numbers are actually comparable to Ontario. So do you think that it does come down to how effective the contact tracing is, that's what's allowing the more targeted approach?
Yeah, absolutely. I mean, I think this is, both places are flying into the storm of the second wave. You have Vancouver and British Columbia, where you have a navigation system that allows you to establish workplace safety, audit it, and again, have a safety blanket of contact tracing if things get worse, to understand where it's coming from, react to it, and get people tested appropriately. And then you have the Ontario situation where the hottest regions, unfortunately, don't have contact tracing. And so there's no security blanket. If you were to get infected in public, there would be no real recognition in a major super spreading event. And unfortunately, that really does lead to this dichotomy of differences between the two in terms of the restrictions imposed.
Yeah, so Dr. Murthy, if you or I were to walk into downtown Vancouver, tomorrow, it would seem kind of normal, right? And we can both go to restaurants, just not at the same table because we have to be within our household group. How do you feel about the approach here in BC? Do you think it's going to be successful?
Well, obviously, I hope so. And a lot of it is contingent, as Dr. Chagla mentioned, about our ability to keep a track of things and whether contact tracing is adequate to stop this spread. So for now, I'm confident that this approach will work. But that being said, we'll see how these next few days pan out.
Dr. Chagla, you co-authored a commentary in the Toronto Star last Sunday, and it kind of pointed out the disproportionate number of people in the South Asian community who are getting infected with COVID-19, and that, a lot of things have to be done to try to change that. Has your message had an impact?
Yeah, I think so. I mean, there certainly have been a lot of conversations at different levels with religious leaders, community leaders, a lot of advocacy that's been done, and even with some political leaders. I think it started a conversation, which is important. I think there is still a lot of work to go, particularly in this population. And, we're hearing about global restrictions today, but there is still a role for vocal stuff in the Peel region, particularly to work on this population, like paid sick leave, better testing and tracing, and incentivization to testing.
And Dr. Murthy, one last thing. You're from Atlantic Canada, which is within the Atlantic bubble, and they've restricted travel. Now, British Columbia's premier would like to see the same thing happen and restrict travel right across the country between provinces. What do you think of that approach?
Like, if you look across the country or even the continent, the Atlantic bubble is the one success story. And one of those lessons is that they restricted travel inwards. In British Columbia, our current orders suggest that we shouldn't travel non-essentially between communities. And so a restriction on travel between provinces makes some sense to me.
It is really interesting to see the different approaches across the country. You know, same virus, but different ways that it's spreading. And thanks to both of you for speaking with us tonight.
No problem.
Last week, we brought you the tragic story of a woman who survived the Holocaust who recently died of COVID-19. Well, the Prime Minister was listening too, and he spoke about it today.
I think about the woman in Toronto who survived the Holocaust and recently passed away from COVID-19. She got married and had kids who loved her dearly. So to her loved ones, my deepest condolences for your loss.
A moment that clearly resonated with so many. We asked her son how he felt about the Prime Minister taking notice of his mother's story, and he had a message for Canadians.
The fact that he quoted some of what I had said in my original interview really touched me and my family tremendously. And this advocacy is so important. Speak to the homes, speak to your politicians, speak to your members of parliament. Make sure that the story is told. It was so important to put stories and faces to these statistics.
As we mentioned, more than 11,000 Canadians have died of COVID-19. In the United States, another record in daily cases today. More members of Donald Trump's inner circle are now sick, and the president still isn't letting go. Up next, we'll look at what this all means for the future of that country. But first, a different kind of pandemic shopping. What installment payments mean for shoppers in 2020. Welcome back. The old buy now, pay later model is one you might be familiar with, but an app newly available in Canada is marketing installment programs to younger people. While it could be useful for some cash-strapped pandemic holiday shoppers, it has some financial planners a little bit concerned. Jacqueline Hansen tells us about Afterpay.
There's a future where you're in charge.
The pitch from Afterpay, one of several installment payment companies targeting millennials with the option to buy anything from jewelry to clothing now and worry about paying for it mostly later. No credit check, no interest charges, and in Canada, no late fees either.
You know, the mission and vision that we stand for being, you know, fundamentally the opposite of a traditional credit provider, you know, one that will always be interest free.
Shoppers sign up for an Afterpay account with a credit or debit card. When they make a purchase, they pay 25% up front. Then every 2 weeks, 25% more is automatically deducted until the purchase is paid off. If there are insufficient funds and a payment is missed, Afterpay disables the account and tries to contact the shopper, but it says it doesn't use collection agencies.
Customers are overwhelmingly responsible.
My daughters love the prints.
Retailers pay Afterpay a fee to take on the risk, as much as 6% of the purchase price.
Providing flexibility, giving access to a different way for a customer to pay in a time where it could be quite challenging for them seemed like a small cost to us in the long run.
Vancouver-based Native Shoes has offered Afterpay online since it launched in Canada in late August. It says about 1 in 20 customers use it.
We see that the average transaction actually increases about 25% when Afterpay is used.
If people could ring up. This certified financial planner says retailers are likely banking on customers spending more to offset the fees.
You know, that's a little unsettling when you think about it.
And she says managing bi-weekly payments could add extra stress and lead to other debt.
If your spending money has been reduced so much, are you going to start resorting to credit at that point to get through for groceries and gas and whatever it is that you need to buy?
Welcome to the future.
Potential consequences to consider that could attach a cost to installment payments, even if companies offering them say there isn't one. Jacqueline Hansen, CBC News, Toronto.
Up next, Donald Trump's latest attempts to change the outcome of the election. The latest strategy from the U.S. president and his team, and what it could mean for American democracy. The Toronto Raptors won't be playing in Toronto for at least the first part of next season. The federal government has denied a request by the NBA and the team to play in Canada, in part because of the spike in COVID cases in the U.S. The country hit a record today with more than 196,000 more people testing positive. Donald Trump met with Republican lawmakers from Michigan, one of the states he won in 2016 but lost this year. As Susan Ormiston shows us, it's the latest effort in a campaign that some say is undermining democracy.
Trump today.
Me during the campaign, which I won, by the way, but we'll find that out. Almost 74 million votes.
2 weeks on, taking no questions, still claiming a rigged election.
Protect our votes!
As top Michigan lawmakers flew to Washington to hear how the president might want that state to override a legal vote which Biden won.
Will you honor the will of the Michigan voters?
There has never been anything remotely like this in American history.
Alex Kazar, a Harvard historian, just published a book on the Electoral College.
The Trump team has effectively given up on the legal strategies, and it is resorting instead to political pressure strategies.
Trump's team has so far lost or withdrawn about 24 lawsuits, but that didn't stop his team yesterday.
We cannot allow these crooks, because that's what they are, to steal an election from the American people.
Today, Giuliani sidelined because his son has COVID-19. So does Trump's son, Donald Jr., isolating now. As another state, Georgia, certified its results today for Biden, a few Republicans, not many, condemned the president's charade. Senator Mitt Romney tweeted, "It's difficult to imagine a worse, more undemocratic action by a sitting American president." But the president's fans are buoyed by his refusal to give in. 70% of Republicans in a recent survey believe the election was stolen.
In the eyes of Mr. Trump's supporters, it delegitimizes the election and Joe Biden.
The Michigan pair emerged tonight to say nothing they'd learned would change the outcome of the election in their state, and certification is on Monday. Forget conceding. Donald Trump is still behind here in the White House trying to weaken the next president moving in. Susan Ormiston, CBC News, Washington.
And some special programming to tell you about. In his only Canadian interview, former U.S. President Barack Obama opens up about his thoughts on the current occupant of the White House and about his new best-selling book, A Promised Land. Watch The National on Sunday night for coverage of Matt Galloway's interview with Barack Obama. Then listen to the full interview on The Current Monday morning after the 8:30 a.m. news on CBC Radio 1 or on the CBC Listen app. After the break, a new Canadian duo.
I just think it's the best thing for Canada.
A superstar collaboration that has fans tuning in. That's next in our moment.
So expensive. Not.
Get this straight. It's free. Perfect.
Two of Canada's biggest pop stars, Shawn Mendes and Justin Bieber, playing together for a brand new single called Monster, and it is a hit. It's a monumental collaboration between these two Canadian superstars, which got other Canadians excited, and their reaction is our moment.
Just let me know. I was 15 when the world put me on a pedestal.
I just think it's awesome that they've collaborated. I just think it's the best thing for Canada. In light of the pandemic, we just, we could use some good news.
I take responsibility for everything I've done. Holding it against me like you're the holy one.
I'm a big music fan, so to see them together, I really think it's special.
I was excited when I heard they were collabing because I've been a fan of both of them for a long time.
What if I sin? What if I break you? Then am I the monster?
Music just kind of draws in everybody. It doesn't matter what age you are.
The Canadian duo coming together is exciting. I liked it a lot.
it's a whole Canadian contingent happening, which is really cool.
It is true. This is the golden age of Canadian hitmakers. There was a week about 4 years ago where those two, along with The Weeknd and Drake, I think had 6 of the top 10 singles on Billboard's Hot 100. And for that collaboration now, as one of the speakers there said, for this to happen during the pandemic, maybe it's just the kind of happy news we need. That is The National for November 20th. I hope you can join me on Sunday for Cross Country Checkup on CBC Radio 1. That's at 4 Eastern. And then later that evening back here for The National. Good night.